Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Very good. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, public health, and infectious disease questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines in our lone US COVID statistic through today, August 22nd. If you have any questions or comments, please feel free to submit them down below or at any of our suggested social media in the description. Starting with that COVID statistic, average COVID deaths per day in the last reported week were 23. In 2024, that number was 105 daily COVID deaths. Your reactions to those numbers, Dr. Murphy?
Yeah, no, so the number of deaths per day, which is the only metric, hard metric that we have, is low, and it's been low for a while. Compared to last year, which was 105. So that was starting to see this increase from the summer bump from last year. So what is happening, we're in this summer bump, this peak, little peak, that is lower than before, but it's still going up. And the wastewater surveillance, they look for the virus in wastewater, and they can tell if a community has a lot or a little. It's a little bit hazy, but they know if there's none, low, medium, and high. So it's high in some areas like Utah, Texas, Nevada, Hawaii, and Alaska. But it's up really pretty much everywhere. So we're in this bump. It's less than last year, but it's there again, and we'll see how this plays out. The big bump will be coming in December and January.
And as we look forward to December and January, that respiratory season, there's some great news for at-home flu administration for that vaccine. Can you tell us about it?
Yeah, so there's AstraZeneca makes a FluMist vaccine. It was approved actually in 2003. It's a nasally administered vaccine. It's approved for people up to 50 years of age. And it works as good as the injection. And they did a study in people who did the flu inhalation, I guess you'd call it, by themselves at home without a healthcare provider. And it worked. Literally every person that did it in this study that they did had antibody levels from this nasal vaccine. So they were so impressed that the FDA approved it. So it's ordered online. I guess the question is who pays for it? Hopefully it's your insurance or whatever. That's always a big issue. But if you don't want to go to the doctor's office and you're under 50 years of age, and it's approved for kids down to 2 years of age, they have to be helped, of course, by the parent. But if you want to do that, it's totally doable and it works.
Yeah, it's another great option to have on the market and very important, as we've talked about before. Last season was an intense flu season. Can you tell us about those numbers a bit?
Yeah, so as COVID has gone down, flu has come back. All right. They're going to be sort of slugging it out there between each other. Last year was a very bad flu season. 266 children died of the flu. There's an estimate of 82 million flu infections occurred in the United States. That's 1 out of every 4 people. 1.3 million hospitalizations for flu. And 130,000 deaths at the high end. These are all estimates because most people that have the flu are not diagnosed. You're just guessing, basically. But if you end up in the hospital, they'll do the test, and there are tests. You can get the test, you can buy over-the-counter tests, you can, all sorts of testing is available. That's not the issue. And treatment is available, more than FluMist. There's other treatments as well. But anyway, since so few people are getting tested, they have to do these estimates. And the estimates aren't that good. And that's why there's such a range. So we know these children who died, they were diagnosed. Now, there could have been more, but we know there were at least 266 kids died from flu. The hospitalization rate for flu, probably most of those people were diagnosed with flu, had a firm laboratory diagnosis. But the number of infections and then the deaths, we're not sure if flu, how well it was documented. And, so there's this surveillance network for flu that the CDC has run for a long time. It's called FluServeNet. And they have basic areas around the United States where they do testing and they do analysis of the people getting tested. And that's where these numbers come from. But there's a beautiful documentation about how it's done. But, because we're not testing enough people, there's a huge variation in the numbers. And so, it's somewhere between 27,000 and 130,000 deaths associated with flu.
Mhm. Now, another illness that has been tracked very closely is that of the measles with this massive outbreak we've had this year. And it's not just an outbreak here in the US, it's all over the Americas. Can you
Yeah.
tell us about the cases here and everywhere?
Well, the measles is the measles epidemic is still going. Most states have had at least some cases. The good news is in West Texas, where this started, there hasn't been a case for 42 days, and they've declared the measles outbreak over in just that area. But it's still other states are reporting measles, and there's a total of 1,375 measles cases reported, 3 deaths associated with that. Now in Canada and Mexico, they even have more cases. Canada actually has the highest number of cases, with over 4,000. Mexico is next with also right around 4,000. Canada's 4,500 and Mexico's 3,900. And then the US is down at 1,300. And we have a lot more people than Canada and or Mexico. So our case rate is even lower, the amount of cases per person. So anyway, it's up everywhere, and it's preventable, and 89% of the cases are in unvaccinated people. So, that's the only way you can control this thing. And remember, it was 0 in the year 2000 when a lot of people were vaccinated. And for flu, only half the people have taken the flu vaccine. And look at all the problems we have with the flu. That's up to 130,000 deaths, and only half of the people are vaccinated. It really is unfortunate, because these vaccines, protect children and adults.
Mhm. And with the vaccine rates dropping over the last couple of years, these massive outbreaks over large swaths of geography really outline how big this change has become. In fact, just this year, the cases have been 34 times higher than last year. It's very significant changes.
It's very, very unfortunate. And if this kind of avoidance of vaccines or vaccine hesitancy, call it what you want. If you're not taking the vaccines, you're at risk. You're part of these numbers.
Mhm. Something that lots of us here in the US are at lower risk for than measles is malaria. However, the chances are not zero, as seen in New Jersey, where there was a novel case. Can you tell us about it?
Yeah, so, malaria, you don't think about getting malaria in the United States. We have all these other diseases we get, but not malaria. But New Jersey, take New Jersey. They have a good health department. They report all the cases. They make the diagnosis. You can die from malaria, especially the first time you get it. They typically have 100 cases per year, but it's people who travel to a country that's endemic for malaria, a tropical country where there's a lot of malaria. But there's a case this year in New Jersey, Morris County, and there's another case in Washington State. in the Tacoma area where malaria was diagnosed and two people who had no travel history. So how did they get it? Most likely, a person who had it was bit by a mosquito, who then bit another person and gave them the malaria. They presume that's what happened. But it just goes to show you that even in a place like New Jersey or Washington State, you can get malaria. It's very unusual, very unusual.
Mhm.
But remember, malaria is very treatable. You just have to make the diagnosis.
Now, sticking to the East Coast, a little different this time, moving to New York City, there has been a large outbreak of Legionella with unfortunately deaths. Can you tell us about it?
Yeah, so Legionnaires disease has been around for a long time, and it's associated with warm water and cooling towers, and so it can be spread through building water systems, and that's certainly what's happening now. They found the growth of this bacteria in 12 cooling towers on 10 buildings, and including a city-run hospital and a sexually transmitted diseases clinic. Um, and the outbreak in central Harlem, where this is occurring, in upper northeast part of Manhattan, has gotten dozens of people have gotten sick, some of them hospitalized. 14 people are still in the hospital. And there was the total death rate is 5 from this particular epidemic, little mini epidemic. So it's Legionnaire's disease is treatable, but if you have underlying medical problems, lung problems in particular, it can be lethal, and you can die from any kind of pneumonia if you're at risk. So that's really what's happening. We had an outbreak at a veterans home, I think it was in Illinois, back a little over a decade ago. That was a big scandal down there. And so it can happen really kind of anywhere. So we have to, when you see clusters of pneumonia, especially, if you can make the diagnosis, which is doable, you have to just be aware that this could be out there and that this could be spreading, aggravating, the risk for this terrible type of pneumonia. So it's that's what's happening, and they are treating the water there and taking care of the people, but it's we have to be vigilant.
Very vigilant. And speaking of vigilance, we talk a lot about recalls when they come up. This latest one is a little bit different than something I've personally seen, and that is potential radioactive shrimp. Can you tell us about it?
This is a very unusual story. Um, I've never heard of anything like this, actually. So it turns out the FDA has put out a warning for consumers in the United States that a brand of frozen raw shrimp that was imported from Indonesia, sold at Walmart, may be contaminated with radiation. The brand is called Great Value. And they have confirmed the presence of cesium-137, which is a terrible radioactive product that people like at Chernobyl were exposed to. They found cesium-137 in shipping containers in Houston, Los Angeles, Miami, and Savannah. And they check ships for radioactivity because you were concerned about somebody importing a bomb or something terrible. But these containers which these inspectors found that had the cesium-137, had been loaded with this frozen shrimp from Indonesia. So now they've looked in some of the products. They haven't found it. Right. So why it was in the container is it really in the product? But certainly nobody wants to take any chances with cesium-137. So they're recommending that people see if they have anything from BMS Foods, frozen shrimp, Walmart, put it all together. The distribution states include Alabama, Arkansas, Florida, Georgia, Kentucky, Louisiana, Missouri, Mississippi, Ohio, Oklahoma, Pennsylvania, Texas, and West Virginia. So if you're in one of those states and you're eating frozen shrimp from Walmart, you may want to check out that package.
Absolutely. Not something we hear about every day, but certainly something to be aware of that is potentially dangerous.
Yeah. So it's a very unusual case.
Very unusual. But on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise, breaking down all of the latest headlines and data for us. It's very much appreciated.
Well, thank you and have a great weekend.
Thank you, and I hope you all have a great weekend as well. Thank you for joining us. If you have any questions or comments, please feel free to leave them down below or at any of our social media linked in the description. Have a great weekend.